Welcome to everyone that's on the webinar this morning. We're glad to have you with us. I'm Jerry Hafer with the Amac Foundation, and I have with me Scott Kellogg. I'll mention him in terms of an introduction in just a minute. And also Eileen Cook. Eileen is one of Amac's esteemed medical and Medicare research analysts.
Yes.
She's also one of the administrative people here in the foundation, and is kind of my partner in crime when it comes to these kinds of things. So welcome to you folks, and welcome to everybody else that's on the webinar. Again, I appreciate you being here. Let me just adjust my screen. The chart that you're looking at now, the PowerPoint presentation that you're looking at now, talks about the sponsoring bodies here, the Association of Mature American Citizens, AMAC, and the Amac Foundation. AMAC is the conservative alternative for America's seniors. AMAC focuses on protecting the interests of America's seniors, watching out for seniors in Washington, making sure that senior issues are represented correctly. We advocate for faith, family, and freedom. That's really our mantra that we advocate under. We have strong representation in Washington, making sure that the interests and needs of our members are being addressed correctly. We have 2.2 million members and growing rapidly. And it's become certainly a national organization. We have representation across the country, primary offices in New York, Florida, New Mexico, and Kentucky. And we are, as I said, the voice of well over 2 million members these days. I would encourage you to take a look at the AMAC website. It's amac.us. That will give you a feel for everything that AMAC is involved in, and it is quite extensive. So again, amac.us is the AMAC main website. Amac Foundation is the public benefit corporation extension of AMAC. We are a 501c3 nonprofit organization with a mission of supporting and educating America's seniors. That's our very succinct mission. We do that in a number of different ways. For example, we maintain 2 information-packed websites open to the public discussing AMAC activities, AMAC Foundation activities, the Social Security Report website, and the Medicarereport website are topical websites that are dedicated to those 2 areas. SocialSecurityReport.org is the Social Security site, and I would encourage you to take a look at that as well. It has a wealth of information about Social Security, background information on the operation of Social Security, the history of Social Security, and most importantly, breaking news about things that are happening in Social Security. It's updated 5 days a week with headline articles and latest news articles, basically keeping the public posted on things that are happening relative to Social Security and retirement in general. Lots of valuable, helpful information on that site. Medicarereport.org is similar to SocialSecurityReport.org in that it contains background information on Medicare and channels a lot of breaking news relative to changes in Medicare as well as healthcare in general. And that's kind of Eileen's baby. She maintains that for us. The SocialSecurityReport.org site is maintained basically by the foundation staff on a rotating basis. And we comb the airwaves for breaking news, as I said, and channel that to the site. So those 2 sites are information packed and extremely valuable for anyone wanting to know about Social Security and Medicare. Again, that's SocialSecurityReport.org and Medicarereport.org. The foundation also maintains an ongoing seminar series. Today's event is one of those. We typically have done, on average, 2 to 3 seminars each month, free public seminars. Some of those are live streamed and carried across the internet through AMAC's communication network, and then recorded and stored on the foundation website. Now, since the pandemic hit us back in March, of course, we've suspended the on-site seminars and have gone to the virtual seminar route like we're doing today. We hope to be able to get back into doing face-to-face seminars once the restrictions are lifted, but that seems to be a moving target these days. I'm not sure when that's going to happen. So for the time being, we're going to continue with the virtual seminars. In fact, we have another one tomorrow. It's pandemic related. It's understanding the PPE world. And we have a few more. You can check our foundation website, amacfoundation.org. And on the events page, you'll see all of the upcoming seminars and webinars that we have scheduled. That website, amacfoundation.org, also contains a lot of information in support of America's seniors. For example, we have a blog page. It's called News and Interesting Information that's updated every Monday with an article of importance to seniors. And as I said, it lists all of our events, and it provides access to the other programs that we operate. And I'll talk for a second about that. The primary flagship program that the foundation operates is the Social Security Advisory Service. We have 5 accredited advisors that handle questions from the public about Social Security. Social Security is, if you've ever taken a look at it or thought about it, or even involved, you understand it's very, very complicated. There are well over 2,700 individual rules that govern how you apply for Social Security. And then there are hundreds of thousands of pages of documentation, some of which countermands those rules, and it becomes very, very complex. So we have advisors that will handle questions from the public and interpret those rules and regulations and put them into perspective for individuals that are aging into Social Security or just have a question and they can't figure out an answer. A request can take 5 minutes or it can take 5 hours. It just depends how complex the situation is. But we handle about, on average, between 400 and 500 of those each month. We have, as I said, 5 accredited advisors. And that, as I said, is our flagship program. We've also done a number of publications along the way since we've been in business as a foundation. We publish a Who's Who in Medicare, Who's Who in Social Security directory, basically as an aid to anyone that wants to track somebody down that's involved in Social Security. It's a directory that has a lot of history information about Social Security, but it's also a roadmap to identify everyone that has a voice at some level in Social Security. We've also published a collection of, we call them Ask Rusty. Ask Rusty is our weekly Q&A bulletin, I guess is what I would call it, where we take a question that we've received and we develop a very well-researched answer and we publish that. And we do that weekly, and we published a book of those, about 80 of those, about a year or so ago, and we're coming out with a new book. Actually, it's in print right now. You know, that'll bring that up to date on. We've done somewhere around 150 of those now at this point. So we do publications as well. That's pretty much what the AMAC Foundation does. As I said, we are a nonprofit public benefit corporation, a 501c3. We do not charge for any of our services. It is all free to the public. And we operate on donations from the public and from AMAC members as well. So that's the end of my corporate overview of AMAC and the AMAC Foundation. I want to talk for a minute about our presenter today, Scott Kellogg. Scott is the Director of Compliance for AMAC's Medicare division. He's a Medicare insurance professional, and he's responsible for the oversight of Medicare sales, compliance, and training within AMAC's organization. He's the sales manager at our Leesburg, Florida location. An extensive wealth of knowledge about Medicare and you know, how Medicare fits individual situations. Scott's been with AMAC since 2014. And interestingly enough, in his background, he came to AMAC after retiring as a deputy chief of a municipal police department. So he has a strong attention to detail mentality, and that's very important when you're dealing with Medicare. I'm sure Eileen can attest to that. You have to be very careful with the details of how they apply to individual situations and what the timing constraints are and all that. So Scott has a incredible background in that area, and has a leadership track record, basically, that allows him to really be a success in that. I'm going to turn it over to Scott. Today's seminar, of course, is oriented towards people that are either aging into Medicare or are already in Medicare and have some questions or things that just don't know. And this, I just got a message, my internet connection is stable. We're having a thunderstorm right now. But I think you get rates and how it's built. So with that, I will turn the program over to Scott Kellogg.
All right, well, thank you, Jerry. I do appreciate the introduction, and welcome everybody to Understanding Medicare. And we're going to try to take this from a perspective of some of the most common questions asked when they call us about Medicare. And our first question generally is first of all, am I eligible for Medicare? And there are some circumstances in which you're eligible for Medicare, and if one of these apply to you, then you are indeed ready to have Medicare. And then we'll talk about some of your options and answer some of your questions as to whether or not you even need to take Medicare right now. But of course, I think most everybody knows that they are eligible for Medicare at the age of 65. That is the age of achievement in which you can go ahead and apply through Social Security Administration to receive your Medicare benefits. You can also get Medicare if you're under 65, but if you are on your 25th month of receiving Social Security disability benefits, on that 25th month, they will go ahead and make you eligible for Medicare benefits. And also, if you are on the 4th month of receiving dialysis for end-stage renal disease, which is permanent kidney failure, if that happens to be your situation, then again, you are going to be eligible for Medicare benefits. There may be some other smaller guidelines, but those are the 3 primary guidelines you're going to look at to see whether or not you're going to be eligible for Medicare through Social Security. So what is Medicare? Now we're gonna, unfortunately, it's confusing with kind of an alphabet soup of parts A, B, C, and D, but we're gonna try to straighten those all out for you so that you have a better understanding that as you're maybe reading material or you're talking to an agent, that you have a better understanding of what these Medicare parts are. So we'll give you a quick summary of them, and starting with Part A, that's going to be considered your hospital benefits. Now, again, through the Social Security Administration, there's not usually going to be a premium due to your work history. You pay your FICA taxes for a period of 10 years, and it doesn't matter the amount that you paid into FICA, it's the length of time that you paid into FICA, and it is also applicable to you, and potentially a non-working spouse is eligible because of your work history. And if that's the case and you meet that criteria, which most Americans do, then you will be eligible through Social Security Administration for Part A hospital benefits for no premium. If you don't qualify, then Social Security Administration will notify you how many credits you have, and depending upon that, there will be a premium due that if you do want to participate in Part A hospital insurance. Now, the Part B medical insurance. Now, hospital, let me kind of back up. Hospital is going to pay for exactly what it sounds like, inpatient hospital stays. It also helps with things like your skilled nursing facility and hospice care. Now, pretty much every other benefit that is approved by Medicare is going to then go under the Part B medical. And as you can imagine, it's going to be things like your doctor's visits, your testing and lab work. Those are the things that are going to be billed through Part B medical. Now, this usually does have a premium, and on average, for the average American income, that is going to be $144.60 per month. And it's actually going to be adjusted next year. It's going to go up in 2021 to the average of $148.50. So a slight rise in the premium cost for 2021 can be expected. It can be adjusted for income. So they'll look back into your taxes paid. I think they start with 3 years ago. They'll look at what your income is, and you might have to pay more depending upon different income levels. And again, Social Security can advise of those things. Now, I want to let you know that Part A and Part B of Medicare go through Social Security. You're not going to go through an agent to receive Part A or Part B. Those are your actually what we call original Medicare benefits that you can obtain through Social Security, and those are the benefits you obtain by having the red, white, and blue Medicare card. Now, the next two parts are something that is an option for you to take. And we're going to talk about these a lot more, but I just want to make sure that you understand that this is the areas, Part C and Part D, in which you'd probably go to an agent to see that if you'd like to do a different option besides just staying on Part A and Part B. The Part C are what we know as Advantage plans. These are private insurances, options of HMO and PPO style plans available to you. And we'll talk about those more. The Part D, which is your standalone prescription drug plans, are also private insurance. They're primarily intended to work with those staying on Part A and Part B, in other words, original Medicare. Part A and Part B do not offer within themselves any kind of prescription drug coverage. So those that decide to stay on Part A and Part B for their services and don't have prescription drug coverage, need prescription drug coverage, will look at something like adding a Part D standalone prescription drug plan. So even though I'm eligible, do I have to take Medicare? So that's one of the first questions we get once they decide, okay, well, I'm 65, I'm starting to get material in the mail. They're telling me I might get penalties if I don't take it, and I've got my company's coverage in place. So the first thing I want to let you know that is if you have credible coverage, like an employer or group plan in place, you can delay your participation in Medicare without any penalties at all. Most employer plans are creditable. If you need to find out for sure, contact your HR or contact the carrier directly and confirm that it is considered credible coverage. But I can tell you that it's very rare for employer or group plan coverage to not be credible. So I do want to let you know that you are entitled to Part A, and I'll discuss that a little bit more here in just a second. But you can delay your Part B and or your Part D. Again, that's the medical and the standalone prescription drug plans without any penalties whatsoever for as long as you want to stay on your employer or group plan. Now let's talk a little bit about being entitled to Part A. Because Part A is premium free, most people can have that if they want it. In other words, it can work with your employer or group plan for hospital stays as a combination to your group coverage and maybe pay more of the bill than you would have expected that you would have been entitled to. They will work together. Who pays first and who pays primary and who pays secondary is going to depend upon how big your employer coverage is. It's the 20 employee mark. So in other words, if you're below 20 employers, or excuse me, below 20 employees within your group coverage, then usually you're going to find that the Medicare will pay primary and your group plan will pay secondary, and it's the opposite of that if you have more than 20 employees. Not really a concern to you, because really all you need to know is that you're entitled to Part A. Go ahead and contact Social Security. They'll issue your card. It will show only Part A benefits. And if you get admitted to the hospital, you can supply that card along with your group plan card, and more likely between the two get most things paid for. So now the Part B medical and Part D prescription drug plans are considered voluntary. But I do want to let you know that if you don't have credible coverage in place, you decide you don't want to participate in either the Part B or the Part D because there is premiums involved, so you do have choices to make. But I do want to alert you to the fact that you could be penalized later on down the road if you do not participate in either one of those parts of coverage without credible coverage in place. So again, really quickly to summarize this slide, if you have credible coverage, you don't have to worry about Part B and Part D. Okay. So how long do I have to sign up? If you decide that you'd like to sign up for Medicare and you're eligible, you do have a 7-month window, which is called your initial enrollment period, in which to sign up through Social Security. Do not contact Medicare to sign up for Medicare. And I know that seems counterintuitive, but Social Security is actually the one in charge of looking at your credits, making sure that you're eligible, issuing your card, and then Medicare is the one you'll contact if you have any kind of appeals or processes you disagree with one of their decisions about covering a particular service. So that's when you'll contact Medicare once you're on Medicare. But Social Security is going to be the organization that you'll contact in order to get signed up. They do provide you this 7-month window, and let's talk about what that 7-month window is. In the middle, you'll see that it says the month of eligibility, and that's either going to be your birth month. It could potentially be the 25th month of your disability, or the 4th month of your end-stage renal disease receiving dialysis. Whatever that month of eligibility then is going to determine the 7-month window. That, of course, is the month that you can start your Medicare. But you do have 3 months prior in order to submit applications in order to get your Medicare started. And then you have also, they give you a little leeway by giving you 3 months after your month of eligibility in order to go ahead and participate in Medicare. Just know that if you don't participate within the 7-month window and you don't have credible coverage in place, then after that 7 months is over, that's when your penalties potentially could start for your Part B and Part D if you don't have other things in place, okay? Now we're talking about whether Social Security actually starts these benefits for you or whether you need to. So it's important to know it's really dependent upon whether or not you receive Social Security benefits. In other words, are you retired? Are you withdrawing out of your Social Security? And if you are, then Medicare will automatically assume that you want to get on Medicare when you turn 65 and you're in your initial enrollment period. They will send you your card, they'll send you your paperwork, and if you don't want to participate, you'll actually probably sign something within the forms, send it back and say, hey, I want to delay my Part B for now. I don't really want to participate, knowing perhaps that you have group coverage already in place. If you do not receive Social Security benefits, Medicare is not going to take the first steps, or excuse me, Social Security is not going to take the first steps. It will be up to you to contact Social Security in order to get your applications, fill them out, and get them started within that 7-month window. So I just want to let you know that it's important that you realize kind of what your status is and don't just expect that Social Security is going to send you all the forms just because you turn 65. If you are not receiving Social Security benefits, you will have to take those first steps. So what are some of your Medicare options? Now, the first option you have as you're considering whether or not you want to participate in any of these parts of Medicare is whether or not original Medicare meets my needs, and maybe I just want to stay on that. And remember that when I use the term original Medicare, I am really referring to Part A hospital and Part B medical benefits. But let's discuss what some of the coverages look like so that you have a better idea of what's whether or not you want to stay on just original Medicare. So for Part A, your inpatient hospital stays, there are some responsibilities on your behalf in order to, unfortunately, let me put it this way, unfortunately, Medicare doesn't pay anything, much of anything, I should say, 100%. So every time you go use a service, there is going to be usually a bill that you'll have to meet unless you have some kind of an extra help situation or maybe combine this with Medicaid services of some type. These are generally going to be your responsibilities. And these are 2020 prices. They may go up for 2021, but they haven't announced any changes in the prices other than when I earlier talked about your Part B premium going up a little bit. So let's talk about the inpatient hospital stay. If you have an inpatient hospital stay, you're going to be responsible for the first $1,408, $1,408, and that is a deductible per benefit period, and it will then cover your hospital stay for the first 60 days. So that is going to be your out-of-pocket cost for the first 60 days for the hospital. Unfortunately, if you are still in the hospital, for every day that you're still in the hospital, days 61 through 90, they will bill you a copay of $352 per day. Now, unfortunately, it goes one step worse, and that is that for every day, days 91 through 150 of your hospital stay, that is going to increase double to $704 per day. Okay, those are actually even considered what we call lifetime reserve days, and not to confuse things, but any one of those days that you use, days 91 through 150, they will be gone forever. So they will not be reusable. It's kind of like a bank. Consider each one of those days $1, and every time you use the dollar, it's not there to be spent the next time. So if you have another hospital stay and you've reached into your lifetime reserve days, that's that many days less that you can actually stay in the hospital with coverage from Medicare. Any costs, you're responsible for all costs, unfortunately, after day 150. So after you've used your lifetime reserve days and you've extended out into a hospital stay beyond 150 days, you will be responsible for all those costs. Now, the other area of Part A is your skilled nursing facility. Don't confuse skilled nursing with perhaps a nursing home or any kind of long-term. What a skilled nursing facility is kind of what I would consider a halfway house. It's preparing you after post-surgery or some type of hospital stay in order to be able to take care of yourself at home, but it doesn't require the full structure of a hospital. You just need some skilled nursing care. Now, this will be paid for by Medicare for the first 20 days, so there'll be no expense to you. But if you're still in the skilled nursing facility beyond 20 days, for every day, days 21 through 100, you will pay $176 per day. And unfortunately for you, that caps out at day 100. If you still need the services and are still in there after 100 days, you're responsible for all costs. So what are some of your Medicare options, well, continued on? Now, what does Part B pay for? Again, remember that's the medical side. And it also has its own deductible of $198. Okay, that's your upfront, that's an annual deductible. And once that's met, then the normal billing will be in a coinsurance in which Medicare will pick up 80% and you're normally responsible for 20% of the coinsurance. So if it's a doctor's visit that you're billed for $100, then they'll pay $80 and you're going to be responsible for $20. Now, this is with the exception of some of the labs and preventative services. Some of these things by law must be covered 100%. When we talk about preventative services, those are things like your colonoscopies, mammograms, there's a full list of things and benefits that are available to Medicare recipients at no cost to them when they're considered preventative services just to check on your current health. So as long as you meet the Medicare guidelines of the age of the test, the frequency of the test, then it will be covered 100% by Medicare. Now, you are also exposed to something we call excess charges. There are a few states that actually made it illegal for doctors to charge excess charges. You can look on the internet and find those different states and find out which ones don't allow for it, but most states do allow for excess charges. And what this means to you is that if a physician does not accept what we call Medicare assignment being what Social Security has already or Medicare has already agreed to pay for certain services, those doctors might actually be able to excess bill up to 15%. And if that happens, you're responsible for the 15%. Medicare does not pay for that. Just know that it's pretty avoidable by most beneficiaries if they will just ask their doctor when making an appointment if they accept Medicare assignment. That's the term you'd use, and if they do accept Medicare assignment, that should mean that you're not going to receive any kind of excess charge. All right, moving on. So when we talk about original Medicare with Part A and Part B, let's talk about some of the benefits of it. Now, one of the benefits is that there is no network. So it allows you to go anywhere in the US or US territories that Medicare is accepted. So if the doctor accepts Medicare, you will have coverage. And it doesn't matter if you want to go to Texas or Louisiana to see a doctor or a specialist. If they accept Medicare, then you're okay. You're going to be covered. So it doesn't bind you by some of the networks that we'll talk about when we talk about Advantage plans. Now, prescriptions, I remind you, are not covered, so you may want to add that prescription drug plan, and prescription drug plans will add an additional premium. Just to kind of give you an idea, this year, we're looking at premiums. Some of the lowest premiums are right around the $17 mark, give or take, and it just depends on what area of the country that you reside on. But they go up from there, and they can go up depending upon your needs and the formulary that you might require. Some of the enhanced plans might be closer to $75 or $100. So we don't normally find that most of our beneficiaries require that level of prescription drug coverage, but just know that if you do, that you might be looking at a premium of anywhere from $75 to $100 potentially. Now, Original Medicare does not have what we call a maximum out of pocket. A maximum out of pocket is, for instance, if you pay your bills to a certain amount, let's just use an amount just for hypothetical reasons. Let's say it's $5,000 and you're paying your medical bills, and at $5,000, when you reach that, a maximum out of pocket would mean that anything beyond that for the remainder of the year would be covered by your insurance plan. You would no longer be responsible for things like maybe your hospital stays or further doctor visits. But Original Medicare does not provide you that benefit. So in other words, anything you are charged, anything over $5,000, there's no stopgap to your billing. Whatever you owe all of it. Now, you do have an option with Original Medicare to add what's known as a Medigap or a supplement plan. And these are added for an additional premium. They're not free of charge, unfortunately. It's going to be like having a secondary insurance through another carrier that's willing to basically be your checkbook. They're not there to approve or decline services. Medicare does that. So if it's an approved service through Medicare, then your supplement plan, and it's again depending upon which one you choose, if it's covered by the supplement plan, they will write the check on your behalf and pay whatever that copay, coinsurance, or deductible that might need to be met on your behalf by paying your monthly premium. Now, there are multiple plan options. So how much is covered, like I stated before, is really dependent upon the plan that you choose. And there are plans available to some beneficiaries that pay for all of your copays or coinsurances. Now, all of the core benefits of these Medigap plans are standardized and identical. And by what I mean by that is that each of these supplement plans are generally provided a letter. So like we don't have enough letters, I understand that. We already have A through D and parts, but these plan options are also given a letter designation. So for instance, let's quickly talk about one of them. The plan F, as in Frank, is the plan in which it will pay all the copays, coinsurances, and deductibles from any of your Medicare approved services. And when we talk about a plan and you purchase a plan, all of these plan Fs are identical. Each carrier, doesn't matter if you buy it from, for instance, Mutual of Omaha versus Aetna. If you buy a Medigap plan, Plan F, it will cover the same gaps in coverage. Each plan is identical. So of course you're looking at which plan might offer me the same coverage, but who's going to offer it at a lower price. Now, with this, it doesn't restrict you any further than Medicare, so you're still allowed to go anywhere that Medicare is accepted. I just want to make sure that you understand that it is a secondary insurance, and many of the beneficiaries, when trying to look at a supplement plan, will call their doctor and ask their doctor, well, do you accept Aetna? And we haven't discussed it in further detail yet, but Aetna also supplies Advantage plans and supplement plans. And when you ask your doctor, do you accept Aetna? They're going to look against their list of contracts for Advantage plans, and you might get the answer that no, unfortunately, we don't take Aetna. When it comes to a supplement plan, it doesn't matter who the carrier is. As long as Medicare is accepted, your supplement plan will be able to pay your portions of costs, whether they take Aetna or any other carrier. So they work in a different fashion. The correct question you need to ask your doctor is, do you accept Medicare and a supplement plan? Because it doesn't matter who is the carrier named on your supplement. Okay. Now, Part B still needs to be paid, and it's intuitive, right? I mean, you have to have A and B benefits because Medicare is the primary insurer. They need to continue to pay what they pay, and then your Medigap plan pays what's left over. And again, what's going to be paid is depending upon the plan you choose, and we're going to talk about that here in just a minute. Now, you can apply any time that you're on Original Medicare, so it's not the same as the 7-month window that you first had. If you decide you want to go on Medicare and then 2 years later you decide I want to apply for a supplement plan, you can. But I do want to warn you that it's a different type of application that you're going to encounter after your first 6 months from when your Part B effective date was. So if you started your Part B right away, let's say you started it this September, you're going to have a 6-month window in which we call the open enrollment period for supplement plans. And by open enrollment, I mean that there's no medical underwriting. They won't ask questions about your current health conditions. In all actuality, you could be potentially have a scheduled major surgery of some type in the very upcoming future, and you're still going to be accepted into the supplement plan because you are in what we call the open enrollment. And remember, that is different than the 7-month window of opening up for your initial enrollment period for Medicare. It is a 6-month window from when your Part B effective date is. So let me kind of give you an example. If you stayed on credible coverage and didn't participate in Part B, and you decided I wanted to work for an additional 4 years, and when you finally go out and you decide, okay, I'm going to retire, I'm going to start my Part B, that delayed Part B effective date is still opening an open enrollment period, even though it's 4 years after you were originally eligible for Medicare. So all it will trigger off is your Part B effective date. Okay, different. So I just want to make sure that I point that out. Now, if you go beyond that 6 months, just be aware that you can still apply for a plan, but now the ability to get into the plan is in the carrier's decision-making process. They can look at your medical history, they can assess risk, they can look at the medications that you're currently taking, and overall do a risk assessment and decide whether or not, with medical underwriting, that they are going to approve you or decline you. So you may, for those that thinking, well, I'll just wait a few years, I'm perfectly healthy right now. You can't wait until something happens, and then you might be at risk of some type, and then decide I want to try to get into this Medigap plan. Okay. Be aware that different states might have different rules, and so it's still helpful to contact an agent. Even if you think that you might not be eligible for one, an agent can look into your state to find out if there might be little differences in different states that might make you eligible where you normally wouldn't be. So it's something that an agent can definitely help you out with. Now, do you know that you can't combine a Medigap plan with an Advantage plan? Medigap plans are only there to cover the gaps in Medicare's coverage. Once you go on an Advantage plan, the copays and coinsurances that you'll pay with an Advantage plan are going to be entirely different. So there's no standardized supplement plan to work with those. It's actually illegal for an agent to put you in both of these plans at the same time because they are never intended to work together. So how do you know which Medigap plan works for you? And remember, we're still talking about the supplement plans. First, I'd say talk to an agent because they're very adept at looking, discussing what your needs are, telling you about the different plan options available to you. And then also because, for instance, I know like in Amac, we have multiple carriers, so we can cost compare all the different carriers to try to determine which one might meet your needs. So just remember the coverages are literally identical. So in many cases, we try to see who can offer you the desired coverage at the lowest available cost. Know that costs may be influenced with things like tobacco use. We also look for things like household discounts. You don't necessarily need to even be married in order to receive the household discount, nor in some states does your spouse need to be applying at the same time. You can get a household discount in some cases from some carriers just based on the fact that you are married in and of itself. And the reason they think about that is that I think over research, those that are married have somebody that helps motivate them, take care of them, make them happier, and overall have a healthier lifestyle than those that may not have somebody in the house with them. So they provide a lower rate. Now, an agent can provide you quotes for any of the available plans. There are technically 11 different plan options, but I don't want that to confuse you because I can tell you right now that all 11 plans are not normally sold. A lot of the carriers on some of their plans, even though they may be offered, are not necessarily at a competitive rate. Most of the time, clients are looking for the Plan F. We're going to talk about these, the Plan F or the high deductible Plan F. That does depend upon your eligibility. Plan G or the high deductible Plan G or the Plan N. So really those are the plans that when you talk to an agent, most likely you're going to discuss. Now you can go into the Medigap guide that Social Security offers. There's a full booklet of reading about these different plans, and I'm going to show you a chart here on the next slide of what these plans offer, the gaps, for instance, that they cover. But if you are interested in any of the other plans, we can provide you a quote, but most clients do not lean towards any of these other plans that I'm not mentioning right now. So here is a chart, and I don't want this to inundate you too much. I'm going to go ahead and get my pointer out so we can talk about what it is that we need to talk about. And let's talk about, if you can see my pointer, I'm going to the Plan F right now. And let's talk about eligibility for that first of all, because not everybody starting the year 2020, those new are eligible for Medicare after January 1st, 2020. And by eligibility, I mean that both your Part A and Part B effective dates show on your card after January 1st, on or after January 1st, 2020. Plan F, unfortunately, is no longer an option for you. Okay. And the reason why, and you kind of see that Plan C is right next to it and they're in blue, is that each one of these plans does something that none of the other plans do. And that is these two check marks right here. If you follow that out to the left-hand column, you see that it pays your Part B deductible. Well, the newest rulings have been that those newly eligible to Medicare cannot be sold a plan in which the Part B deductible is actually covered. So if you have Part A or Part B prior to January 1st, 2020, either of them, then you are okay. You can purchase a plan if you'd like to do that. And that is the most comprehensive coverage. It covers, as you can see, the check marks show that it covers every single one of the gaps in Medicare's coverage. So if you just pay your monthly premium, as long as it's a Medicare approved service, your Plan F cuts a check and it pays whatever your costs are, the hospital stay, the deductible, that up to $704 per day that you might be charged, this plan is going to pay for that. It also adds some additional benefits. So things like, instead of just the 150-day cap, it will pay for an additional 365 days of hospital stay after your Medicare benefits are used. So it goes beyond what Medicare authorizes. It actually gives you another year of hospital stay in your bank that you can use, and it will pay for those days. Some other things that it does beyond Medicare is that it will pay for foreign travel emergency, and that's up to some plan limits. Let me quickly describe what that means. But if you are a traveler, if you go outside of the United States, you can receive emergency care. It's only for emergency care within the first 60 days of your trip outside the United States. And what it is with a $250 deductible, they will pay 80% of your billed charges up to a lifetime limit of $50,000. So that's what the emergency care does. But Medicare doesn't normally offer any coverages outside the United States, and this adds that for at least emergency room coverage. Okay. Now, if you are not eligible for Plan F, and most people do, not most, but many people purchase the Plan G, even though they might be eligible for the Plan F. And the reason they do that is because the premium is pretty well reduced. Carriers like to influence their beneficiaries into certain plans. Plan G is something that they really wanted a lot of people to start participating in, knowing that the Plan F was no longer going to be eligible to newly Medicare recipients. And so they have, in most cases, a very lucrative premium for Plan G. It's quite a bit reduced over the Plan F. And the only difference between these two plans is that Plan G will not pay your Part B deductible. And if, just as a reminder, that's the $198 annually. It's not a huge deductible, but if you purchase a Plan G, that is going to be your next most comprehensive coverage. Okay. And again, the only difference between the two plans is it's not going to cover your Part B deductible. Now, the other option quickly is the Plan N. That's something that a lot of clients, again, the premium is going to be reduced because it does reduce a little bit of the benefits. The way that it reduces the benefits is that it also doesn't pay the Part B deductible of $198, but it's not going to pay the excess charges. So again, it's avoidable if you ask your doctor if they accept Medicare assignment. But if you do get billed excess charges and you have a Plan in, then you will be responsible for the excess charges. And remember, that can be up to 15% over what Medicare has authorized to pay. The other thing that makes the Plan N different is it adds copays. So it's kind of got the flavor of the HMO or the PPO style plan where you go see a doctor. Some of your office visits may be a copay of up to $20, and then $50 copays for emergency room visits that did not result in inpatient admission within the first 24 hours. So you can expect that when you go, they might collect a copay or they might bill you the copay after the fact, but just know that you might be responsible for a small copay. with the plan in. But again, it does reduce the premium. So we usually talk about these different options with our beneficiaries so that they can determine what meets their needs. Now there's high deductible versions of the Plan F and the Plan G, and let's quickly discuss those. What that means to you is that you will have Medicare always paying. They will pay from day one of the year their portion. But if you decide that you want to go with the high deductible version, and first let me let you know that these are greatly reduced premiums. You're talking more in the $40 per month as opposed to say $100 per month. So you're saving a lot of money in premium. And the way they work is they basically lay dormant up until the point that you've reached $2,340 of out-of-pocket expenses. So remember when I talked about original Medicare and that it didn't have a maximum out of pocket. Whatever you're billed, you're responsible for all through the year. This is basically like purchasing a maximum out of pocket. So when your out of pocket expenses reach $2,340, your Plan G or your Plan F, high deductible Plan G or Plan F, kick in and will pay for the remainder of your approved costs through the remainder of the year. So it's like, again, it's like purchasing a stopgap to your billing. So a lot of people decide, hey, you know what, I'm healthy, I like that. It's got a small premium. It makes sure that I'm protected, that, you know, if I have a really bad year medically and I've got $15,000 in expenses through Medicare that I'm responsible for, well, if I have a high deductible Plan G or high deductible Plan F in place, my expenses will max out at $2,340. Okay. So those are the options that we primarily look at when we're looking at those types of things. Let me get the pointer turned off here. Okay. So now that we've kind of discussed Medigap and that being your option to attach to your Medicare as an additional protection, let's talk about some of these other options like your Medicare Advantage plans. Again, I'll just remind you that's what the Part C of Medicare was. Now, these actually replace your original Medicare, your A and your B, with a private carrier's plan. And these are primarily going to be the traditional HMO and PPOs that you might have through your group coverage now, or maybe you've had through private insurance. And you're agreeing to go on this Advantage plan for the calendar year. So it's each one of these plans, when you sign up for it, even if you sign it up for it in the middle of the year, it basically runs its course to December 31st. If you're on a plan that's going to continue to the next year, because they do re-up their contracts with the federal government each year, and if it's going to carry over to the next year and you like your plan, you don't need to take any action. It will actually just roll over to the next year. So you don't have to call an agent and re-enroll into that plan. If you like your plan, you can just keep it. And they'll notify you via mail or emails, whatever you decided that you'd like to have as your favorite communications with the carrier. They will let you know whether or not the plan is going to carry over. And if it doesn't carry over, they'll give you plenty of notice. And that way you can decide whether or not you want to change your plan during the annual enrollment period. Now, premiums are generally much lower for these Advantage plans. Excuse me, let me grab a drink. So premiums are generally much lower in an Advantage plan than they will be a Medigap plan. It might be as low as $0 per month. And that's very common. I think most people have seen the commercials where, excuse me, Humana or one of these other plans will have commercials saying, hey, no premium. And that's true. Most of these do, because the reason they don't collect a premium is that you're already paying into Social Security. You're paying a monthly premium. You've already paid your FICA taxes, yet you're not using Medicare benefits for your hospital and medical needs. So it's only fair now that Social Security turns some of that money back over to the Advantage plan for you to participate into it. And so you will find many of these plan options available to you at no monthly premium. You still have to keep paying your Social Security benefits. So just because it's $0 doesn't mean you don't have to keep paying your Part B premium to Social Security. That will still have to occur. Now, you will have co-pays and co-insurances and possibly deductibles for your hospital and medical services, but they might look a little bit different than they will on Medicare. I described your Part A and Part B and what you'd be responsible for, but when you participate in an Advantage plan, Some services may cost less than if you stayed on Medicare, and some services may cost more. And it's really up to you, probably working with an agent, to try and find a plan that suits your needs, where you like some of the copays, you're agreeing with the premium, they cover your medications, and those types of things. Okay. Now, why take an Advantage plan? You're thinking to yourself, I still am responsible for things like, the copays and coinsurances, just like I would be if I stayed on original Medicare. But there are some differences that might attract you to an Advantage plan. And these are things that they add, or might add, I should say, and most times you'll find that they do. But again, it's on a case-by-case basis, but they might include additional coverages beyond what Medicare covers. And those are things like vision, dental, and hearing. Medicare doesn't cover any comprehensive areas like that. In other words, they're not going to help you with your prescription glasses. They're not going to help you with teeth cleanings or preventative x-rays. Yes, if you had a medical necessity, if I got in a car crash and I broke my jaw and knocked out some teeth, then Medicare more than likely would approve a medical situation in order to help repair that. But for all the comprehensive coverages like teeth cleaning and getting bridge work done or cavity fillings and things like that, Medicare doesn't normally pay for those type of services. An Advantage plan will help you pay for those. It also helps with things like wellness coverage. Those are things like your silver sneakers or silver and fit programs, in which they'll help pay for some of your gym memberships and those types of things. Another nice thing is that prescription drug coverage is usually included in these plans. Okay, so if you're going to stay on original Medicare and pick up a standalone prescription drug plan, remember that's Part D, there's usually going to be a premium involved. However, if I find a $0 premium Advantage plan that also covers my prescription drug needs, I may not have any additional premium. So I basically attach the prescription drug plan to my Advantage plan at no additional charge on a monthly basis. It doesn't mean that you won't have prescription drug costs. In other words, over-the-counter costs, your copays or coinsurances that might exist with the different levels and options of the different medications. You'll still have an over-the-counter cost most likely on most medications, but as far as a premium, that will usually be at $0 as well. And I do want to let you know that Advantage plans by law must require a maximum out of pocket. Right now, the most an HMO plan can have is $6,700. So if you go out of pocket $6,700 on an HMO plan, then the plan will continue to pick up all of the other approved services for the remainder of the year. If you choose a PPO plan, it's also $6,700 if you stay within the network, but PPOs allow you to go out of the network. And if you use a combination of in and out of network services, then I think that maximum out of pocket is $10,000. So it goes up a little bit. Now, all these plans are subject to Medicare's 5-star rating system, and the ratings may change each year. I want to make sure that you understand that, because as you might do research on your own, maybe you go to Medicare.gov, see all the plan options that are available in your area. They will always provide you a 5-star rating, it's the 5-star rating system. So it's any, 3 out of 5 stars or 5 out of 5 stars. So that gives you a comparison between the plans. And they do their research each and every year based on cost, the network availability, whether your availability to see doctors, whether your medications were covered. There's a slew of things that they're going to look at in order to provide that carrier with a rating. And so it does give you the availability of looking one plan against the other and compare based on the star rating system that they've received. Now, plans can be changed yearly during the annual enrollment period. If you're new to Medicare and you don't know these dates, it's helpful to put on your calendar. But October 15th through December 7th, you can call any agent, or you can do it yourself and switch plans, look at other plans, and put in an application during that time period, regardless of your medical condition. It doesn't matter, whether or not you have any ailments, any serious risk or health conditions. The new plan will always take you. The new Advantage plan will, regardless of medical condition. Now, any applications that we receive October 15th through December 7th, they will be effective January 1st of the next year. but make sure that you understand that those dates are very strict. You can't call on December 8th and ask for an application to change your plan. Unfortunately, it's going to be too late. So let's discuss with these Advantage plans. Now, there are other options. There's, besides HMO and PPOs, but they're not frequently sold. Most people like these two style of plans. So these are the ones we're going to concentrate on. The first being the HMO, which is really a health maintenance organization. They generally require a primary care physician to act as a gatekeeper, and they will then provide your referrals to see specialists. I think most people are aware of HMOs and how they work. And if you don't follow the plan's rules for service, then you'll likely have to pay the full cost. So you can't receive any routine care outside of the established network in most HMO plans. So if you travel for lengthy periods of time, a snowbird type situation where maybe you go from New York to Florida and you spend 5 or 6 months of the year outside of your home network, say in New York, then potentially this might not be the plan for you. But it does allow for out-of-network coverage for things like ER and urgent care. So if you have an HMO, you're not one of those snowbirds, but you do travel a little bit, say to see family, you travel to Texas for a couple of weeks and you just want to visit with the grandkids, something like that, you will have coverage for those necessities. So it's not like you're without any medical coverage if you might need it, but it's not going to be for routine care. So I can't be visiting my family in Texas, decide I want to get a little lump checked on my elbow or something and go see a regular doctor for that. That's not going to be covered under the HMO. It will also cover things like out of area renal dialysis. You need pre-authorized visits to see a specialist, so you can't necessarily go straight to the specialist and make an appointment. And the rules might be more restrictive compared to other plans, but it might be offset by lower plan costs. So why take an HMO? Well, first of all, we have to see what's available in your area. And sometimes there's only HMOs available. There's not a PPO option. So it's something we need to look at if you want a PPO. However, if an HMO meets your needs, it might come with a lower cost. In other words, maybe your copays or coinsurances might be a little bit less. Your maximum out of pocket might be a little bit less. So there are some benefits if you decide you want to go with an HMO, but we want to make sure that as you make those choices for an HMO, you also understand what some of the limitations might be. Now, a PPO is considered a preferred provider organization, and these allow you to go to any doctor or hospital that accepts Medicare. But know that if you go outside the established network, because they still establish a network, they prefer you stay in the network, there's going to be a lower cost generally associated with that. But if you decide I need to go out of the network, I really need to see this other doctor, and they accept Medicare, then your insurance should be accepted, but you'll know that you're generally going to pay more than if you obtained your services within the established network. These will not usually require a primary care physician. You can basically go see any doctor within the network, and you can also, in many cases, make an appointment directly with a specialist. So if you have, you injured your knee, and you know that when you go see your primary care physician, they're just going to send you to a specialist anyway. Maybe you've re-injured it, you've already seen a doctor, you can go straight to that specialist. So just know that that's a possibility under the PPO plan, whereas the HMO plan, more than likely not going to be the possibility. Now, these may be less restrictive, but just know that your premiums, copays, or coinsurances might be slightly higher than they will be with an HMO option. Again, the only way to know that for sure is whether you pull up these plans that are available in your area using Medicare.gov. If you like to use your computer, call an agent. We can pull up these different plan options and really do somewhat of a comparison to determine whether or not the copays are similar between an HMO or PPO. And sometimes, even though they're a little bit higher, you might decide that a PPO plan is the only option for you. Again, if you're in that snowbird situation, long periods of time where you need routine care outside of your home network at a common basis, a PPO plan might be your only option. So just to let you know, if you were to call an agent, this is the things that they should be doing for you. First of all is doing what we call a needs analysis. We really want to get to know what it is, what are your activities, what's your travel like, Is your doctor in the network? Are your medications covered? Those are the things that we're going to be looking at in order to try to pinpoint a plan that's going to meet your needs. So let's talk about these 5 factors. The first is, do you need or require a PPO versus an HMO? Or are both options open to you? In such case, we'll look at all of the different options. But if we know that a PPO is the only plan type that you want, then we'll make sure that we restrict our research to just the PPO plan. Are your doctors important to you? And if so, are they in the plan's network? If they aren't, not a big deal. You can choose any plan you like as long as you're willing to switch your doctor if they're not in network. But we do have ways to determine whether or not your doctor's in the network at the plan that you're looking for. And so that can help comfort you knowing that, hey, if I take this Aetna plan, I know my doctor's in network and you can continue to see that doctor. Do know, please, that doctors can leave a network at any time. So even though they're currently contracting, and I used Aetna as a example before, know that at any time they decide they no longer want to contract with Aetna, they can leave the plan. But you unfortunately can't leave the plan to go follow your doctor. You're still committed to that plan to the end of the year. So I just want to make sure that everybody's aware of that as they make their decision to go into Advantage plans. If your doctor's super important to you and they decide to leave the network, you may not be able to follow that doctor until the next year in which you can change your plan. Will the plan cover my medications? That's something we look at as well. Are they on the formulary? Can you continue to go to the pharmacy of your choice, or do you need to change pharmacies in order to receive the lowest cost option available for your medications? That's important to look at. And am I overall satisfied with the copays and coinsurances and deductibles that the plan offers? And so an agent will review these with you, but if you're not going to use an agent, if you're going to go strictly by yourself to Medicare.gov, then these are the 5 areas that I would really recommend that you look at in order for you to determine whether a plan option is suitable for you or not, okay? Don't just simply look at the copays, coinsurances, oh, it's a $0 plan, that's the plan for me, and assume that you can see your doctor, because that might not be the case. So make sure you do your homework. Most agents, you don't have to pay an agent, so if you decide to use an agent, the agent gets paid from the carrier. So know that you can call any agent you'd like. We prefer, of course, that you call Amac, but if you use any other agent, normally there's not a fee to do that. So there's really no harm in calling a professional in order to try and help you through this process. So let's summarize your choices. I want to make sure we kind of go over this and make sure you understand. The first thing is you got to decide, do I even want to go on Medicare? You're eligible, yes, but do you want to go on Medicare? Call an agent, compare your employer coverage to what Medicare can offer. So even if you're on group coverage, it doesn't hurt you to look into Medicare, because in all actuality, Medicare may offer you a lower cost, more comprehensive coverage package than even your group plan can offer you. But know that if you decide to leave your employer coverage, you may not be able to get it back. So those are some things to consider, but at least it benefits you to check into it to determine, hey, maybe I just want to go on to Medicare anyway, even though I still have the availability of group coverage, because maybe my Medicare options are actually more suitable for me. The other thing is decide if you might want to join Medicare and combine that with group coverage. Even though you can delay your Part B and there's no penalties, some people decide that they want to have both. And if you put both in place, in other words, A and B, and then combine that with your group coverage, that's basically like having a supplement or a Medigap plan in place between those two, because it will be a primary and secondary coverage. Remember, it just depends on the size of your company, who pays first and who pays second. But regardless, the point to you is that most things are going to be paid for. However, know that if you decide to join Medicare now and you start your Part B, that 6-month window that we talked about for your open enrollment for Medigap plans is going to start ticking, I should say. And once your 6 months is gone, it's gone forever. That open enrollment is gone. And so if you work another 3 years and your Part B started 3 years ago and you get off and decide to retire, and you decide, hey, a Medigap plan works for me, if you have medical conditions, you may not be able to get into some of the plans that you like, okay? So just be aware of that as you make your choices. Now, if you decide to join Medicare, you can either stay with original Medicare's A and B, and then one, add a Part D standalone prescription drug plan, or two, also add a Medigap plan to help cover your costs. And remember, there's about 4 or 5 different Medigap plan options that primarily you're going to be looking at, but that is your option A, is those things that you can add to original Medicare. And again, some of the benefits are no network anywhere in the US, and of course a pretty comprehensive package because you have a primary and secondary insurance to pay on your behalf. Or you can elect to participate in a private carrier's advantage, considered a Part C plan. Of course, Part C is going to offer you the medical coverage, the hospital coverage, and more than likely your prescription drug coverage, and also add additional benefits that Medicare doesn't provide for, things like your dental, vision, hearing, silver sneakers program, some things like that, and it will offer you a maximum out of pocket as well. One of the big decisions is you got to decide whether an HMO or PPO plan works for you. And again, your ability to get into those plans is what's available in your area. We have to look and see what kind of networks have been put together, whether their PPO plan is an option. It might be HMOs only, it might be PPOs only. So don't assume for certainty that both plan options are available in your area. It just depends on where you live in the nation. So that all being said, and that kind of summarizes everything of what your options are as you come onto Medicare. I'll open it up this time for questions. If anybody that might have any questions, hopefully I can be helpful in that area. But yeah, just let me know if any questions come up.
Okay, great. Then I think we'll wrap this up. And Scott, again, I want to thank you very much for your time and for an excellent overview. I think it's very helpful for people. Okay, thank you very much, and thank all of you for attending, and look forward to having you on other webinars in the future. Just check our amacfoundation.org events page. That's amacfoundation.org, and then just go to the events page. There's a tab at the top that says events, and that'll give you a overview of all the seminars and webinars that we have planned. So I'll thank you all, and with that, we'll end the session. And everybody take care and stay safe. Thank you.